So tonight's lecture is over chapter 21. It begins on page 771, and the topic tonight is the cardiovascular system, blood vessels, and hemodynamics. Blood vessels contribute to homeostasis by providing the structures for the flow of blood to and from the heart and the exchange of nutrients and wastes in tissue. They also play an important role in adjusting the velocity and volume of the blood flow. So the purpose of this chapter is to discuss the development, structure, and function of our blood vessels, examine the factors that affect blood flow, discuss how the body controls blood pressure and blood flow, compare and contrast the various circulatory routes in the body, and learn about shock, disorders, and disease associated with the blood vessels. Blood vessels are a part of the circulatory system, and in conjunction with the heart and the blood, they help to transport blood throughout the human body in order to perfuse tissues. The heart generates blood pressure to pump blood through the tissues through the vascular system. So the five main types of blood vessels are arteries, arterioles, capillaries, venules, and veins. Arteries carry blood away from the heart to other organs. Large elastic arteries leave the heart and divide into medium-sized muscular arteries that branch out into various regions of the body. Medium-sized arteries then divide into small arteries, which in turn divide into still smaller arteries called arterioles. As the arterioles enter the tissue, they branch into numerous vessels called blood capillaries, or simply capillaries. The thin walls of capillaries allow the exchange of substances between the blood and body tissues. Groups of capillaries within a tissue reunite to form small veins called venules. These in turn merge to form progressively larger blood vessels called veins. Veins are the blood vessels that convey blood from the tissues back to the heart. So as I said on the previous slide, the major types of blood vessels are the arteries, which carry blood away from the heart, the capillaries, which enable the actual exchange of water and chemicals between the blood and tissues, and the veins, which carry blood from the capillaries back toward the heart. Again, arteries carry blood away from the heart to other tissues, and they are high-pressure, low-volume reservoirs, and they have thick, elastic walls. Arterioles are small arteries that are less elastic. They have more smooth muscles. They provide the greatest resistance to blood flow that help to regulate blood pressure, and they regulate flow into the capillary beds. Capillaries are the site of exchange with tissues, the location for the exchange of gases and nutrients between blood and tissue cells. Composed of a single layer of endothelial cells, thin, flattened cells that line the inner wall of all vessels and the basal membrane. Venules and veins are low-pressure, high-volume reservoirs. They regulate cardiac filling. Blood flow to critical organs and tissues is regulated through the mean arterial pressure. Blood vessel structure. In general, a blood vessel has three layers: the tunica interna, the innermost layer adjacent to the lumen; the tunica media, which is the middle layer, and this is composed of smooth muscle and elastic fiber; and then the tunica externa, which is the outermost layer adjacent to the surrounding tissue. The arteries and veins have three layers, but the middle layer is thicker in the arteries than it is in the veins. The tunica intima is a single layer of simple endothelial cells surrounded by a thin layer of subendothelial connective tissue with a number of circularly arranged elastic bands. The tunica media is the thickest layer in the arteries, circularly arranged elastic fiber and connective tissue. The tunica media may be rich in vascular smooth muscle, which controls the caliber of the vessel. The tunica adventitia is entirely made of connective tissue. It also contains nerves that supply the vessels as well as nutrient capillaries in the larger blood vessels. So this is on page 773, figure 21.1. So as I said, arteries carry blood from the heart to the tissues, and veins carry blood from the tissues to the heart. And in this cartoon, we can see the stark differences between the arteries and the blood vessels. For instance, the arteries are on the left there, and the veins are on the right. So you can see they both have the tunica interna, the endothelium, the basement membrane. Then the artery differs because it has this internal elastic lamina. They both have a tunica media. This is composed of smooth muscle, and notice in the artery that the tunica media is much more thick. And the artery has this external elastic lamina, and then they both have a tunica externa. And as you can see, the tunica externa on the artery is slightly thicker than it is on the vein. Differences between blood vessel types. Walls of the arteries are the thickest. We said that on the previous slide. The lumens of the veins are larger. So there's something we didn't mention. Skeletal muscles, quote-unquote, milk blood in veins toward the heart. Walls of capillary are only one cell layer thick to allow exchange between blood and tissues. Structure of arteries. Elastic and conducting arteries are larger in diameter. They have high pressure, and that can fluctuate. Muscular medium arteries, they're composed of smooth muscle that allows vessels to regulate blood supply by constricting or dilating. Arterioles transport blood from small arteries to capillaries. So this is again figure 21.1 on page 773. And now we just see the artery there by itself. But the reason I'm showing this slide again is because I wanted you to look at the micrograph there in the lower right-hand corner. So this shows what an artery looks like under a microscope. As I've said several times now, arteries carry blood away from the heart to the tissues. The walls of the arteries are elastic, which allows them to absorb the pressure created by ventricles of the heart as they pump blood into the arteries. This converts a pulsatile to steady flow. Because of the smooth muscle in the tunica media, arteries can regulate their diameter. And again, we've said this several times too, so arteries are high-pressure, low-volume reservoirs. Types of arteries. Elastic arteries or conducting arteries are large in diameter. They have more elastic fibers and less smooth muscle, and they function as pressure reservoirs. Muscular arteries or distributing arteries are medium in diameter. They have more smooth muscle, fewer elastic fibers. Smooth muscles allow the vessels to regulate blood supply by constricting or dilating. They distribute blood to the various parts of the body. This is figure 21.2 on page 774. And this shows the recoil of arteries that keeps blood flowing during ventricular relaxation. So there at letter A, the elastic aorta and arteries stretch during ventricular contraction. And then at B, the elastic aorta and arteries recoil during ventricular relaxation. Anastomosis is the union of branches of two or more arteries supplying blood to the same region of the body. This provides an alternate route for blood flow. Arteries that do not form an anastomosis are called end arteries. If an end artery is blocked, blood cannot get to that particular region of the body and necrosis can occur. Arterioles are small arteries that are less elastic. They contain more smooth muscle, and they provide the greatest resistance to blood flow that help to regulate blood pressure. They help to regulate the flow into the capillary beds. They transport blood from small arteries to the capillaries. And they have a very small lumen. So this slide goes back to figure 21.1 on page 773. And this just kind of shows you a cartoon of a capillary. And then at the bottom of the slide, you see there's a light micrograph of a capillary. Capillaries are microscopic vessels that usually connect arterioles and venules. Capillary walls are composed of a single layer of cells and a basement membrane. Because their walls are so thin, capillaries permit the exchange of nutrients and waste between blood and tissues. So page 776, figure 21.3. Capillaries branch to form an extensive capillary network throughout the tissues and are found near almost every cell in the body. In capillaries, nutrients, gases, and wastes are exchanged between the blood and the interstitial fluid. Capillary beds, there are two types of vessels. The vascular shunt that directly connects an arteriole to a venule, and then there's true capillaries. Oxygen and nutrients cross to cells. Carbon dioxide and metabolic waste products cross into the blood. The wall consists mostly of endothelial cells and basement membranes. The types of capillaries are classified by diameter and permeability. The three types are continuous, fenestrated, and sinusoidal, or discontinuous. So this is figure 21.4 on page 777. And this is a series of 3 slides that relate to this figure. So we see on this first slide, we're looking at what we call a continuous capillary. Most capillaries are continuous capillaries in which the plasma membrane of the endothelial cells form a continuous tube that is interrupted only by intracellular clefts, gaps between neighboring endothelial cells. Continuous capillaries are found in the central nervous system, lungs, muscle tissue, and the skin. Moving on to the next slide. Fenestrated capillaries. Other capillaries of the body are fenestrated capillaries. The plasma membranes of endothelial cells in these capillaries have many fenestrations, or small pores, ranging from 70 to 100 nanometers in diameter. Fenestrated capillaries are found in the kidneys, intestinal villi, choroid plexuses of the ventricles of the brain, ciliary processes of the eyes, and most endocrine glands. And moving on to the next slide, we see a cartoon of a sinusoid capillary. Sinusoids are wider and are more winding than other capillaries. Their endothelial cells may have unusually large fenestrations. In addition to having an incomplete or absent basement membrane, sinusoids have very large intracellular clefts that allow proteins and, in some cases, even blood cells to pass from a tissue into the bloodstream. For example, newly formed blood cells enter the bloodstream through the sinusoids of the red bone marrow. In addition, sinusoids contain specialized lining cells that are adapted to the function of the tissue. Sinusoids in the liver, for example, contain phagocytic cells that remove bacteria and other debris from the blood. The spleen, anterior pituitary, parathyroid, and suprarenal glands also have sinusoids. Capillary fluid exchange. Diffusion. The rate of diffusion depends on the permeability of the membrane, the concentration gradient, and the surface area available. Filtration. This depends on the permeability to water and the pressure gradient. This figure takes us back to 21.1 on page 773. And this is just a cartoon of a vein. So we're going to switch gears now and start talking about veins and venules. Venules are small vessels that are formed by the union of several capillaries. Venules drain blood from capillaries into the veins. Figure 21.5 on page 778. Veins are formed from the union of several venules. Compared to arteries, veins have a thinner tunica interna and media and a thicker tunica externa. Veins have less elastic tissue and less smooth muscle than arteries. Another unique thing about veins is that they contain valves. Valves and veins allow blood to flow in one direction only, and that's toward the heart. So what assists the blood flow in veins? Well, that's skeletal muscles, the respiratory pump, smooth muscles under sympathetic control, and gravity. And table 21.1 shows the distinguishing features of the blood vessels. So this table is on page 780, and I'd like for you to spend some of your own time reviewing this. So moving on to the next slide, blood distribution, and this is figure 21.6 on page 781. At rest, the largest portion of the blood is in the systemic veins and venules, and these are called blood reservoirs. Because systemic veins and venules contain more than half of the total blood volume, they are called blood reservoirs. Capillary exchange. Substances cross capillary walls by diffusion, transcytosis, and bulk flow. So you should remember diffusion from your basic biology courses, but let's talk quickly about transcytosis. That's where a small quantity of material crosses capillary walls. In this process, substances in the blood plasma become enclosed with tiny pinocytic vesicles that enter the first endothelial cells by endocytosis. Then they move across the cell and exit on the other side by exocytosis. This method of transport is important mainly for large lipid-insoluble molecules that cannot cross capillary walls in any other way. For example, the hormone insulin enters the bloodstream by transcytosis, and certain antibodies pass from the maternal circulation into the fetal circulation by transcytosis. Bulk flow, on the other hand, is a passive process in which large numbers of ions, molecules, or particles in a fluid move together in the same direction. The substances move at rates far greater than can be accounted for by diffusion alone. Bulk flow occurs from an area of higher pressure to an area of lower pressure, and it continues as long as a pressure difference exists. Diffusion is more important for solute exchange between blood and interstitial fluid, but bulk flow is more important for the regulation of the relative volumes of blood and interstitial fluid. Pressure-driven movement of fluid and solutes from blood capillaries into interstitial fluid is called filtration, and pressure-driven movement from interstitial fluid into blood capillaries is called reabsorption. So as I said, I'm not going to spend a lot of time on diffusion, but substances such as oxygen, carbon dioxide, glucose, amino acid, and some hormones cross capillary walls via simple diffusion. As I said on the previous slide, large, insoluble molecules like insulin cross capillary walls and vesicles via transcytosis. And, as I said on the couple slides ago now, bulk flow is a passive process in which numbers of ions, molecules, or particles in a fluid move together in the same direction. Bulk flow occurs from an area of higher pressure to an area of lower pressure, and it continues as long as a pressure difference exists. Bulk flow is more important for the regulation of the relative volumes of blood and interstitial fluid. Filtration and reabsorption. Filtration is a pressure-driven movement of fluid and solutes from blood capillaries into interstitial fluid. Blood hydrostatic pressure and interstitial fluid osmotic pressure promote filtration. Reabsorption is pressure-driven movement of fluid and solutes from the interstitial fluid into the blood capillaries. Interstitial fluid hydrostatic pressure and blood colloid osmotic pressure promote reabsorption. So this cartoon is figure 21.7 on page 783, and this shows the dynamics of capillary exchange. Blood hydrostatic pressure pushes fluid out of capillaries, this is filtration, and blood colloid osmotic pressure pulls fluid into capillaries, and that's called resorption. So in Starling's law of the capillaries, under normal conditions, the volume of fluid and solutes reabsorbed is almost as large as the volume filtered. So in this equation, we see the net filtration pressure equals, parentheses, the blood hydrostatic pressure plus the interstitial fluid hydrostatic pressure, unparentheses, minus the blood, parentheses, the blood colloid osmotic pressure plus the interstitial fluid osmotic pressure, unparentheses. In terms of physiology, arteries and veins can regulate their inner diameter by contraction of the muscular layer. This changes the blood flow to downstream organs and is determined by the autonomic nervous system. Vasodilation and vasoconstriction are used antagonistically as methods of thermoregulation. Also, oxygen is the most critical nutrient carried by the blood. In all arteries apart from the pulmonary artery, hemoglobin is highly saturated with oxygen. In all veins apart from the pulmonary vein, hemoglobin is desaturated. Also, the blood pressure in the blood vessels is traditionally expressed in millimeters of mercury. In the atrial system, this is usually around 120 millimeters of mercury systolic, that's the high pressure wave due to the contraction of the heart, and 80 millimeters mercury diastolic, which is the low pressure wave. In contrast, pressures in the venous system are constant and rarely exceed 10 millimeters of mercury. Moving on to the next slide, vasoconstriction is the constriction of blood vessels by contracting the vascular smooth muscle in the vessel walls. It is regulated by vasoconstrictors. These include paracrine factors, a number of hormones, and neurotransmitters from the nervous system. Vasodilation is a similar process mediated by antagonistically acting mediators. The most prominent vasodilator is nitric oxide. Furthermore, permeability of the endothelium is pivotal in the release of nutrients to the tissue. It is also increased in inflammation response to histamine, prostaglandins, and interleukins, which lead to the most of the symptoms of inflammation. That includes swelling, redness, warmth, and pain. Factors affecting blood flow resistance. Resistance occurs where the blood vessels away from the heart oppose the flow of blood. Resistance is an accumulation of three different factors: blood viscosity, blood vessel length, and the vessel radius. Blood viscosity is the thickness of blood and its resistance to flow as a result of different components of the blood. Blood is 92% water by weight, and the rest of blood is composed of protein, nutrients, electrolytes, wastes, and dissolved gases. Depending on the health of an individual, the blood viscosity can vary. Vessel length is the total length of the vessel measured as a distance away from the heart. As the total length of a vessel increases, the total resistance as a result of friction will increase. The vessel radius also affects the total resistance as a result of contact with the vessel wall. As the radius of the wall gets smaller, the proportion of blood making contact with the wall will increase. The greater amount of contact with the wall will increase the total resistance against the blood flow. Factors affecting the blood flow. This is also called hemodynamics, and this starts on page 784. Blood flow is the volume of blood that flows through any tissue at any given time period, and this is measured in milliliters per minute. The total blood flow is the cardiac output, the blood volume that circulates through the systemic or pulmonary blood vessels each minute. So figure 21.8, page 784, blood pressures in various parts of the cardiovascular system. The dashed line is the mean or average blood pressure in the aorta, arteries, and arterioles. Blood pressure rises and falls with each heartbeat in blood vessels leading to capillaries. So what contributes to blood pressure? The contraction of the ventricles generates the blood pressure. Blood pressure is determined by the cardiac output, blood volume, and vascular resistance. And the higher the blood pressure, the greater the blood flow. So you can see that according to the graph there, that the blood pressure is higher in the arteries than it is in the veins. Vascular resistance, or we can call this R. R is the opposition to blood flow due to friction between blood and the walls of the blood vessels. The higher the R, the smaller the blood flow. And R depends on three things: the size of the blood vessel lumen, the blood viscosity, and the total blood vessel length. Moving on to the next slide, venous return, the volume of blood flowing back to the heart through the systemic veins, occurs due to the pressure generated by contractions of the heart's left ventricle. The venous return is assisted by valves, the respiratory pump, and the skeletal muscle. So here's figure 21.9 on page 786. And this shows an example of the skeletal muscle pump. So milking refers to the skeletal muscle contractions that drive the venous blood back toward the heart. So there, while you're standing at rest, the venous valve closer to the heart, or the proximal valve, and the one farther away from the heart, the distal valve, in this part of the leg are open and blood flows upward towards the heart. At step 2, contraction of the leg muscles, such as when you stand on your tiptoes or take a step, compresses the vein. The compression pushes the blood through the proximal valve, an action called milking. At the same time, the distal valve in the uncompressed segment of the vein closes as some blood is pushed against it. People who are immobilized through injury or disease lack these contractions of the leg muscles. As a result, their venous return is slower and they may develop circulation problems. And at step 3, just after muscle relaxation, pressure falls in the previously compressed section of the vein, which causes the proximal valve to close. The distal valve now opens because blood pressure in the foot is higher than in the leg, and the vein fills with blood from the foot, and then the proximal valve will reopen. The velocity of blood flow. This is figure 21.11 on page 787. Velocity of blood flow is the slowest in the capillaries because they have the largest total cross-sectional area. Blood flow is the volume of blood that flows through a tissue in any given period of time. Blood flow is inversely related to the cross-sectional area of the blood vessels. Figure 21.10, page 787. This is a summary of the factors that increase blood pressure. Changes noted in green boxes increase the cardiac output, and changes noted in the blue boxes increase the system vascular resistance. Increases in cardiac output and increases in system vascular resistance will increase the mean arterial pressure. So control of blood pressure and blood flow. And we've actually seen this cartoon before in the previous chapter. This is figure 21.12 on page 788. The medulla oblongata contains a cardiovascular center, which is a group of neurons that regulate heart rate, contractility, and blood vessel diameter. The cardiovascular center is the main region for the nervous system regulation of the heart and blood vessels. Control of blood pressure and blood flow continued. Page 789, figure 21.13. Baroreceptors are pressure-sensitive neurons that monitor stretching. Baroreceptors are important pressure-sensitive neurons that monitor stretching of the walls of the blood vessels and the atria. Baroreceptors, pressure-sensory receptors, are located in the aorta, internal carotid arteries, and other large arteries in the neck and chest. They send impulses to the cardiovascular center to help regulate blood pressure. The two most important baroreceptor reflexes are the carotid sinus reflex and the aortic reflex. Baroreceptors in the wall of the carotid sinuses initiate the carotid sinus reflex, which helps regulate blood pressure in the brain. The carotid sinuses are small widenings of the right and left intracarotid arteries just above the point where they branch from the common carotid arteries. Blood pressure stretches the wall of the carotid sinus, which stimulates the baroreceptors. Nerve impulses propagate from the carotid sinus baroreceptors over sensory axons and the glossopharyngeal nerves to the cardiovascular center in the medulla oblongata. Baroreceptors in the wall of the ascending aorta and aortic arch initiate the aortic reflex, which regulates systemic blood pressure. Nerve impulses from the aortic baroreceptors reach the cardiovascular center via sensory axons of the vagus nerve. So this is something that we talked about back at the beginning of 221, and this is figure 21.14 on page 790, but the regulation of blood pressure is a negative feedback loop. So please go through this negative feedback loop on your own time and study it. Table 21.2 on page 791. This shows how blood pressure is regulated by hormones. So I'll let you go through this table on your own time. Autoregulation of blood pressure. Autoregulation is the ability of a tissue to automatically adjust its own blood flow to match its metabolic demand for delivery of oxygen and nutrients and the removal of wastes. Physical and chemical stimuli can lead to autoregulation. Moving on to the next slide. This is table 21.3, and this is on page 792. So if you study this slide, you will learn pulse points. And if you're studying to be in the medical industry, this is probably something that would come in handy. It could come in handy anyway. So please review this table on your own time. Moving on to the next slide. Shock and homeostasis. And this is page 793. Shock is an inadequate cardiac output that results in failure of the cardiovascular system to meet the metabolic demands of the body cells. Shock is a progressive, life-threatening condition in which the circulatory system fails to deliver enough oxygen-rich blood to the tissues and organs. Cell membranes dysfunction, cell metabolism is abnormal, and cell death may occur. So there are many different types of shock. Hypovolemic. A common cause of hypovolemic shock is acute or sudden hemorrhage. The blood loss may be external, as occurs in trauma, or internal, as in rupture of an aortic aneurysm. Loss of body fluids through excessive sweating, diarrhea, or vomiting can also cause hypovolemic shock. In cardiogenic shock, the heart fails to pump adequately, most often because of myocardial infarction or heart attack. Other causes of cardiogenic shock include poor perfusion of the heart, heart valve problems, excessive preload or afterload, impaired contractility of heart muscle fibers, and arrhythmias. So even with normal blood volume and cardiac output, shock may occur if blood pressure drops due to a decrease in systemic vascular resistance, and that's an example of vascular shock. Then obstructive shock occurs when blood flow through a portion of the circulation is blocked. The most common cause is a pulmonary embolism, a blood clot lodged in a blood vessel of the lungs. So this next slide just goes through a number of different types of shock as well, and we've already talked about a couple of these, but we'll go through it. Cardiogenic shock is due to heart diseases. Hemorrhagic shock is due to excessive bleeding. Hypovolemic shock is due to loss of fluid, dehydration, severe burns, heat stroke, diabetic coma, severe diarrhea, severe vomiting. Anaphylactic shock is due to a severe allergic reaction. Septic shock is due to an infection of the blood. A spinal shock is due to injury of the spinal cord or the brainstem. Respiratory shock occurs due to the failure of the lungs. Electrical shock occurs as a result of electrocution, and psychogenic shock is due to the emotional reaction of an event. Homeostatic responses to shock. Activation of the renin-angiotensin-aldosterone system occurs. Secretion of antidiuretic hormone occurs. Activation of the sympathetic division of the autonomic nervous system occurs. And then the release of local vasodilators will occur. And then this next slide, we see a cartoon here on page 795, figure 21.16. And this is a response to a hypovolemic shock, which is a negative feedback system that can restore normal blood pressure during hypovolemic shock. So it makes sense that it's a negative feedback loop. Homeostatic mechanisms can compensate for an acute blood loss of as much as 10% of the total blood volume. Please study this slide in more details on your own time. So moving on to circulatory routes. This is on page 796. Arteries, arterioles, capillaries, venules, and veins are organized into circulatory routes that deliver blood throughout the body. Now that you understand the structures of each of these vessel types, we can look at the basic routes the blood takes as it is transported throughout the body. So we have 4 types of circulation that we'll discuss, and that's the systemic circulation, the pulmonary circulation, the hepatic portal circulation, and the fetal circulation. The systemic circulation includes all arteries and arterioles that carry oxygenated blood from the left ventricle to the systemic capillaries, plus the veins and venules that return the deoxygenated blood to the right atrium after flowing through the body organs. Concerning the pulmonary circulation, when blood returns to the heart from the systemic route, it is pumped out of the right ventricle through the pulmonary circulation to the lungs. In capillaries of the pulmonary alveoli sacs of the lungs, the blood loses some of its carbon dioxide and takes up oxygen. That turns it bright red again and returns it to the left atrium of the heart and re-enters a systemic circulation as it is pumped out of the left ventricle. In fetal circulation, this exists only in the fetus and contains a special structures that allow the developing fetus to exchange materials with its mother. So this is figure 21.17 on page 797. And we can see that the blood vessels are organized into various routes that deliver blood to the body tissues. So there in the center, you see the heart, and you can see as the blood is pumped out of the left ventricle, it goes into an artery. So just to be clear, the arteries are in red, or the book is calling this oxygenated blood, and then the blue is the deoxygenated blood, but it also represents the veins. So you can see that the blood is pumped from the heart, moves through the body, and as it becomes deoxygenated, it enters into the venous system and moves back to the heart, where it is then pumped out through to the pulmonary circulatory route, and that allows the blood to lose its carbon dioxide content and take up its oxygen, which turns it bright red, and then the pulmonary circuit will return it back to the heart. So this next slide is on page 799, and this is figure 21.18, and it shows the aorta and its principal branches. So all systemic arteries branch from the aorta. And this next slide is figure 21.18 continued, and this you have to turn to page 800 to see it. But these two slides that I just showed you, they're dealing specifically with the arterial system. Please spend your own time studying these two slides in greater detail. So this cartoon is figure 21.20 on page 805. And we can see the aortic arch and its branches. The aortic arch ends at the level of the intervertebral disc between the fourth and fifth thoracic vertebra. And this next slide is also part of figure 21.21. So here we see how the arteries are moving superiorly into the cranial region. And this slide is also part of 21.20 on page 805. And this is the inferior base of the brain showing the cerebral arterial circle. So this figure 21.21 appears on page 808. And this shows the thoracic aorta and the abdominal aorta and their principal branches. The thoracic aorta is a continuation of the ascending aorta. So study this in more detail on your own time. So this next cartoon appears on page 812, figure 21.22. And this is an anterior view of the celiac trunk and its branches. And these next slides I'm going to show you will outline the abdominal aorta and its principal branches. The abdominal aorta is a continuation of the thoracic aorta. Moving on to the next slide, same figure, but now we have an anterior view of the superior mesenteric artery and its branches. So again, study the details of this on your own time. Next slide. Now we're looking at an anterior view of the inferior mesenteric artery and its branches. And with this slide, we see it in the view of a cadaver. So this is the anterior view of the arteries of the abdomen and pelvis. And this is also on page 813, and it's still part of figure 21.22. So moving on to the next slide, and continuing with the systemic circulation, we see the arteries of the pelvis and the right lower limb. The internal iliac arteries carry most of the blood supply to the pelvic viscera and wall. So here we're just looking at a posterior and anterior view of the leg, the right leg. And this is figure 21.23 on page 816. So this brings us to page 818, figure 21.24. And this is an overall anterior view of the principal veins. So you can study the details of this on your own time, but the deoxygenated blood returns to the heart via the superior vena cava, inferior vena cava, and the coronary sinus. So here's figure 21.25, and this shows the principal veins of the head and the neck. The blood draining from the head passes into the internal jugular, external jugular, and the vertebral brains. So this is figure 21.26 on page 824. And this deals again with systemic circulation. The deep veins usually accompany arteries that have similar names. So the veins of the principal veins of the thorax, abdomen, and pelvis, this is 21.27 on page 826. So most thoracic structures are drained by the azygos system of veins. And this systemic circulation continued. This is on page 831. So you can see the veins of the leg area, the lower pelvis and the leg. And here's figure 21.28 on page 832. The deep veins usually bear the names of their companion arteries. So the right anterior tibial vein is probably in close proximity to the right anterior tibial artery. So moving on to the hepatic portal circulation. This is page 833, figure 21.29. This is a schematic diagram of blood flow through the liver, including arterial circulation is shown. As usual, deoxygenated blood is indicated in blue and oxygenated blood is indicated in red. I don't really see any red on this slide. The hepatic portal circulation delivers venous blood from the organs of the digestive canal and spleen to the liver. And this is page 834, figure 21.29 continued. And this is just kind of a generic diagram of the hepatic portal circulation. So on the next slide, figure 21.30 on page 835, the pulmonary circulation brings deoxygenated blood from the right ventricle to the lungs and returns oxygenated blood from the lungs to the left atrium. Same figure, same page. We see this pulmonary circulation in kind of a cartoon form. So you can see pulmonary trunk, and then we've got deoxygenated blood going to both the left and right lungs. And as that is reoxygenated, that is going to be returned to the left atrium so the heart can pump it back through the body as oxygenated blood. Fetal circulation begins on page 836, and this is figure 21.31. So the circulatory system of a fetus, and this is called fetal circulation, exists only in the fetus and contains special structures that allow the developing fetus to exchange materials with its mother. It differs from the postnatal circulation because the lungs, kidneys, and digestive canal organs do not begin to function until birth. The fetus obtains oxygen and nutrients from the maternal blood and eliminates carbon dioxide and wastes into it. So in this cartoon, the gold boxes between parts A and B describe the fate of certain fetal structures once postnatal circulation is established. The lungs and the digestive canal organs do not begin to function until birth. So here we're moving on to page 837, and this shows the scheme of fetal circulation. And this next slide shows the development of blood vessels and blood. And this is figure 21.32 on page 839. But blood vessels develop from isolated masses of mesenchyme in the mesoderm called blood islands. Blood vessel development begins in the embryo on about the 15th or 16th day after fertilization. Aging in the cardiovascular system. Aging results in loss of compliance of the aorta, reduction in cardiac muscle fiber size, progressive loss of muscular strength, decline in maximum heart rate, and increased systolic blood pressure. So this focus on homeostasis is on page 841 in your textbook. It shows the contributions of the cardiovascular system for all body systems. The heart pumps blood through blood vessels to body tissues, delivering oxygen and nutrients and removing waste by means of capillary exchange. And circulating blood keeps body tissues at a proper temperature. So I'll let you go through this on your own time and read about how the cardiovascular system helps to contribute to homeostasis in all of the other body systems. Moving on to homeostatic imbalances, which begins on page 839. But about 45 million Americans have hypertension or high blood pressure. It is the most common disorder affecting the heart and blood vessels and is the major cause of heart failure, kidney disease, and stroke. New guidelines for hypertension have been instituted because clinical studies have linked what were once considered fairly low blood pressure readings to an increased risk of cardiovascular disease. These new guidelines are as follows. Normal blood pressure, the systolic less than 120 and the diastolic less than 80. Elevated blood pressure is where the systolic is between 120 to 129 and the diastolic is less than 80. Hypertension stage 1, systolic pressure is between 130 to 139 and the diastolic is between 80 and 89. Hypertension stage 2, this is where the systolic pressure is greater than 140 or the diastolic pressure is greater than 90. And then a hypertensive crisis is where the systolic pressure is higher than 180 and the diastolic pressure is higher than 120. Diseases. Blood vessels play a huge role in virtually every medical condition. Cancer, for example, cannot progress unless the tumor causes angiogenesis, which is the formation of new blood vessels to supply the malignant cells with their metabolic demand. Vasculitis is the inflammation of the blood vessel wall due to an autoimmune disease or infection. Next slide. Blood vessel permeability is increased in inflammation. Trauma may lead to hemorrhage due to mechanical damage to the vessel endothelium. In contrast, occlusion of the blood vessel by atherosclerotic plaque by an embolized blood clot or a foreign body leads to downstream ischemia. Coronary artery disease, arteriosclerosis with narrowing of the arteries supplying the blood to the heart muscle. Coronary artery disease makes a heart attack more likely. Carotid artery disease. arteriosclerosis with narrowing of one or both of the carotid arteries in the neck. This disease of the carotid arteries makes stroke more likely. When blood vessels connect from a region of diffuse vascular supply, it is called anastomosis. Anastomosis provides critical alternative routes for blood to flow in case of blockages. Temporal arteritis. Inflammation of the temporal artery in the scalp. This comes with pain in the jaw, with chewing and pain over the scalp are common symptoms. Next slide. Stenosis of the arteries. The narrowing of the arteries usually caused by arteriosclerosis. When stenosis occurs in arteries in the heart, neck, or legs, the limitations in blood flow can cause serious health problems. Peripheral artery disease. Arteriosclerosis that causes narrowing of arteries in the legs or groin. The limitation in blood flow to the legs may cause pain or poor wound healing. Arterial thrombosis. This is a sudden clot in one of the arteries, stopping blood flow. Immediate treatment is necessary to restore blood flow in the artery. Myocardial infarction or heart attack is a sudden blood clot in one of the arteries supplying blood to the heart. Cerebrovascular accident or stroke. This is a sudden blood clot in one of the arteries supplying blood to the brain. Strokes may also occur when one of the arteries in the brain bursts, causing bleeding. And that concludes tonight's lecture.